Yeah, it's all done. 6:10. Shall we start the proceedings? So if you have any doubts, we'll have a quick question and answer session. Along with me, SAHITHI ma'am and Gauri Shankar sir are going to join in the last half of the session. But straight away, I want to jump into the contents, what I thought of discussing with you. So welcome to MDS Conquer. And I am Dr. SRIKANTH, done my UG from St. Joseph Dental College, Eluru. Probably I was intern in 2012, 2013, exactly 10 years before I was an intern like you with a similar mindset. Lots of confusions, and finally I have cracked the rank, and I have done my master's from Vishnu Dental College, Bhimavaram in Endo department. And further, we have started this MDS Conquer long ago in 2015-16, and you are going to be the fresh orientation batch. You're going to be the 9th batch of MDS Conquer. Okay, so you're the 9th batch. So 9, I strongly recommend, I strongly believe 9. 9 is the luckiest number for me. Okay, so this is the 9th batch of MDS Conquer, and heartily welcome each and every one of you for this lovely interactive session, which is going to be more informative, and it's going to be more informative, and it's going to give lots of information related to dentistry around the globe for which you are accessible. The first and foremost thing, I want to congratulate each and every one of you for clearing your final year and entering into internship. And of course, now a doctorate tag is being added, which is, I strongly believe that is something, a magical feeling that every one of us has on the day of result. So first of all, congratulations. Yes, you have did it. You have did it. Do you accept this? You did it something, or you are forcefully done with your exams, or you have done something. I just need a two-way communication, at least in the initial halves. You feel like you did something in BDS, or forcefully you're done. You joined, things were done first year, second year, COVID came. COVID has eaten two years more. Okay, and lots of things happen, mixed feelings, exam postponed, preponed, lots of things are happening because of this 19. Okay, I'm talking about 9, and 19 is more important throughout the world. Okay, so something you have done it. Okay, so my first question, all of you, whether it's an intern or a repeater, my first question is, what is real success and what is real achievement when you're in final year? Leave out first year, second year, third year, and fourth year. What do you feel is a real achievement in a final year? In a final year, maybe once you're posted to 8 departments, brushing here and there, eight records, lots of staff, lots of work, lots of patients. What do you feel is a success? What do you feel is an achievement in a final year? Someone is telling clearing 8 subjects. Extraordinary. That's the best answer. The best answer for me. Clearing the quota, clearing the final year subjects. Okay. I mean, like maybe there may be 3 or maybe 5% of students will be really extraordinary. I'm not talking about those 5% of students. I'm talking on behalf of 95% of students. Means 95 students in a 100 batch. Their main success and achievement in a final year is to clear the exams, clear the theory and practical, and jump into internship. This is what I vote for. This is 95% of the students will believe that they want to clear. No, we are always so busy. We are always so busy and packed with this pandemic one, followed by 8 departments, forces from everywhere, lots of quotas, lots of records to be done. There is lots of unnecessary stuff to be done in a final year. Okay, we are least bothered about learning in final year. We are least bothered about managing the patient management. We are least bothered. We are more bothered about other things because they are going to give you the pass tag that you are going to enter into internship. Do you accept this or not? Do you accept this? This is a strong gut feeling when I was there. That is 10 years back. And do you accept this? What I'm telling is, do you accept this? Yes. A few people are telling yes. Okay. So my next question for you. What is real success and achievement in an internship? Now, final year, okay, final year, everyone are so packed, record signs, people will screw you up. You have lots of tensions. Then I'll ask you the next question. You are interns, you have started your internship. Now tell me, what is the real success and real achievement you are planning in an internship? Confidence in our judgment, getting into ADS, building the passion towards dentistry, Yes, good, very good. Passion towards the dentistry, confidence in your judgment, like whatever you are opting, you should be confident in telling that to your parents or anyone. Exposure to more patients, very good. Planning for MDS, very good. Any other? Not to depend upon professors for the clinical judgment. Yes, of course, internship is something like internship. The basic definition of internship is it's a transfer period from, for a baby, it's a transfer period. It's a growing phase where you have to take your own judgments, have to take your own calls in handling the patients without taking help of others, like maybe without direct supervision or indirect supervision. If you can handle the things better, then you can go and survive outside. Learning everything by ourselves. Yes, wonderful. Okay, gaining knowledge by exposure. Yes, very good, very good. I really appreciate you. Learning something from each and every case. Learning. Internship is a phase of learning. But most of us, including me, when I was an intern 10 years back, including my batchmates, we used to have that particular norm about internship. Internship is enjoyment. Internship is entertainment. Internship, so many teachers, professors has irritated you. That's a time that you have to take revenge on them. Okay, internship is a phase of entertainment, enjoyment, trips, tours, parties. This is what I'm really hearing from so many of the students in the present generation. And like we used to have this particular crowd of people we used to have during our phase also, but after 10 years, I feel that percentage of people who has this norm of internship is lots of enjoyment, entertain, just relax, enjoy the college, take the revenge, whatever you want. You can plan your revenge, something like you see all movies, right? First half, hero will suffer, second half, hero will take revenge. That is how the story will be concluded. So many of the people nowadays has this norm. So, okay. So, I mean, like few of you may jump into the next part, PG. What is success and real achievement in PG? So once you enter into PG, you have some norms in your brain. Okay. So what PGs do around you? They do cases, they work hard, not all, but most of them, they want to learn something. So it's always learning. What I say is, it's always internship is learning, PG is learning, and post PG means after PG also, you should start learning, implementing the things, opening the clinic, working under someone, working in the college. There are many things they go on. So what I strongly believe is life is always a phase of moving to the next level. Okay, you move from first year to second year to third year to final year. Now you are interns. Probably once you crack rank or do something, you may go to abroad, or you may move to PG, first year, second year, third year. Then you come out into market to practice. This is what life is. Do you accept this? This is what life of a doctor is. Particularly, doctor's life will be like this only. Let it be an MBBS background, let it be a BDS background, or let it be an Ayurveda, or whatever it is, your background will be like this only. Okay, means you need to move yourself from one level to other level. Keep on moving. Yes, do you accept it? I want a two-way reciprocation so that we'll try to be more interactive in the next few hours. Okay, I want more response. More response. We have more than 175 crowd, which is a very decent crowd. Okay, for an online session, which have a recorded option too, so you can watch whenever you want. Yes, I want that lovely response. Okay, so what iPhone is doing, what Apple company is doing, they have started some 5, followed by 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15 is coming, right? Means every year what they're doing, they're upgrading it, they're updating it. So profession, dentistry is always updating. Okay, it's always updating. Whenever you see, it is always updating. And if you only have the habit of updating yourself, only then you can survive here. Only then you can survive here. Okay, without updating habit, you want to get settled down, you cannot. Even after opening the biggest clinic, after having the highest position in dentistry, you should get upgraded with the knowledge. You should get upgraded with the system around you, society around you. Do you accept this or not? You always need an upgrading. You want to stick onto the same phone for 10 to 15 years, or you want to keep on changing your phone, changing your clothes, new clothes, new phone, new books. So we always love to get upgraded. So finally, so before starting the session, going in detail into the session, how are you feeling now? How are you feeling now? I'm asking in dentistry. I'm asking dentistry. Now, few of you are planning to prepare for exam. Few of you are in internship. Few of you maybe in the final year, or you may done your internship long back. So what is your feeling about dentistry or about your position? Even I am dentist. I'll tell my feeling. What is your feeling about the profession or about your position in dentistry? What do you feel? No, you have multiple options. Okay. You have, you know, all these emotions: excited, confused, happy and proud, confused. Come on, throw the answers. Confused about life, worried, lost, confused, worried, tensed, confused. Yes, lovely. So this is what the answer I expected. And this class or this session is going to give a total clarity about this confusion. Okay, the reason why I have thrown this question is I want you to tell confused. If you have a clarity, then there's no point of taking this particular session. So I want every one of you, I'll give a beautiful clarity about dentistry. So I was in dentistry. Okay, so I was in dentistry. So I have started my journey in 2007, 2008. So completed my internship in 2012 and 2013. So I am 10 years ahead of you. Simply telling, I'm 10 years ahead of you in dentistry. I'm 10 years ahead of you. And if you ask me what is my present feeling about my profession or dentistry, what I can tell is I am very, 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 very happy and very, 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 very proud. And I made my parents as well as my family proud. And trust me, if you ask me the same question in 2012, 2013, probably 10 years back when I was an intern, now you have an answer that you are telling that you're confused, you're sad, you are afraid or some XYZ, but my answer is none. I don't have any feelings. I don't have any feelings. Please don't write anything here. Just a second, because it will be recorded also. I just need 5 minutes. Someone has written something on my pad and it will be I'm so headache. Okay, so I cannot rub that. That is the reason why I have so many softwares working to project this as a live. Okay, anyway. So Priya, if you can remove that, please try to remove that. If you have any option to remove that, whatever you have written on my screen, please try to remove that because I'm not able to see any option from my side. Okay, anyway, so now you have the freedom of telling that you have a feeling. Okay, but 10 years back, I don't have the right to tell my feelings also because I'm so confused about dentistry. I don't have an answer. I don't have any feelings about dentistry because we don't have this lots of internet source. Like if you open YouTube and see lots of stuff is there about dentistry, but now long back 10 years back, we don't have that. So whatever my seniors are telling, I used to follow. Whatever my teachers are telling, I used to follow. Once I'm done with my exam, my senior is going to tell something, I used to follow. Followed by few days, other senior is going to tell, and I used to follow. This is what my pattern of approach towards the dentistry. So finally, what I can tell you is I have learned so much about dentistry in the last 10 years, and I learned only from my mistakes. So I have done so many mistakes in dentistry, and I learned from all my mistakes. So I finally decided to tell my story. Okay, so let's start my stories. Very exciting. It is most often like, I can consider this as KGF part 1 and part 2, or you can consider it as Bahubali part 1 and part 2. So interesting. Lots of twists, interval bangs are there. Climax will be extraordinary. Okay, trust me, you're going to enjoy the story. So shall I start the story? I want you to be active. I want you to be active. So active, damn active. Should be very fast, yeah. You are 5G kids, okay, 5th generation. You are 5G kids here. You have to so fast. Right, very good. So finally, so coming to UG level, I'm very good student at a UG level. Okay, I used to score well, read well, because I don't have so many friends. So books are my friends. I used to sit in the library. I used to read a lot. And finally, final year out and results came and I got distinction. Very happy. So next day, immediately one of my senior, I met my senior who is always guide to me. He's also topper. So he used to guide me and he told me to start the preparation immediately without wasting any time, because he is the one who has got the best rank when they were giving the entrance. And right now he's done with Endo from GDC, from a very good GDC. So he started me, SRIKANTH, let's start the preparation without wasting any time. So immediately I bought all the books and everything necessary. So I have started my preparation. So once one person is starting the preparation in a library, is reading very seriously, what is going to happen? Everyone are going to see him. Okay. So everyone has an eye on me. My batchmates, my juniors also very interested on me. My seniors so interested on me. So people keep on coming and giving me some suggestions. Okay. So everyone used to come and give my suggestions. I have decided to get into MDS, which is suggested by my senior, but finally I came out with different plans. So I came out with a different plan. Okay. So one of my senior told, why to prepare now? Why you are so hurry? You can take 1 year gap. I bought my books. I joined a coaching center. Okay. Then my senior, one more senior told, come on, let's enjoy, take break. Okay. So let's join a clinic. 1 year you work in a clinic, you learn so many things. Okay. Then you can think of whether you want to do MDS or not. So then what happened? Again, one senior came, so given suggestion. I thought, okay, let's join in the clinic. So I joined in the clinic. I started working. The work is going on. I have quitted my preparation, but I have given the exam. But I have quitted my preparation because my senior told. I have started the preparation. Why? My senior told. I have quitted the preparation. Why? My senior told. So once I start working with a very good clinic, days are going on. I used to have few of my seniors working in the same clinic after doing their MDS. Okay. And one of my senior who has done with MDS, he was sitting with me and he's telling me, SRIKANTH, now you are not to be here. You are very talented. You should be in USA, or you should be in Canada, or you should be somewhere. I thought that is true. I realized that is a true. He's telling true. And I was feeling like that KGF movie, you know, like that scenes. I am feeling so energetic and I felt like, yes, let's go to USA. Why I'm planning for USA? My senior told. Why I have started the preparation? My senior told. Why I have quitted the preparation? My senior told. Why I thought of starting the practice, joining a clinic? My senior told. Everything my senior told. I don't take any decisions, my seniors. So finally, my senior told, relax and start your journey to USA. Again, plan A shifted to plan B shifted to plan C. And finally, I have opened Google and I have opened Facebook. Okay. I have seen my seniors who are going to, I have seen beautiful photographs like this, lots about dentistry. So I was so excited. So few of you are telling that so excited about dentistry. This is what excitement in the dentistry. Till the date, I was never excited about dentistry. Okay. I was excited seeing all these photographs and started my journey to USA. Okay. So after 3 months, now it's an interval bank. Can you guess what has happened? Come on. If you already know my story, no, I don't want you to answer. Okay. Can you guess what has happened? Yeah, of course. Interval bang means you will have a twist. That is for sure. Again, senior. Of course, seniors will be there throughout your life. Don't worry. Every place you will have a senior. Once you enter into any department, you will have a senior or a PG guiding you. Okay, so after lots of waiting, again, plan has changed. Okay. So one more senior told, okay, I realized myself that I'm not fit for USA because I'm not financially so strong. Because I asked my father about this. He said, no, impossible. How can you go for USA? I cannot even spend a flight ticket for you to go to USA. Impossible. I said like, so I came into reality. Then I went to my home and my seniors again told me, sir, you have to open a clinic. No, you have hardly 2 clinics in your hometown. You are very talented, distinction candidate in the final year, very energetic talker. Okay, let's open a clinic. You can easily grab that. He asked me, where is your father basically? Okay, my father is from past 35 years, he's in the same hometown. Well, your father will have lots of circle, open a clinic. Then I thought of opening a clinic. My father said, no, I don't have money for the 2 or 3 lakhs. So then the twist came. The twist is this, finally. So tell me, what is the twist here? What is the twist here? Yes. Perfectly right. Okay. It's not my marriage. My girlfriend's marriage was over. Okay. She was waiting. How long she will wait? Okay. How long a BDS girl can wait? Hardly she will wait for 1 to 2 years. I thought of preparing for entrance. I joined a clinic. Then I thought of going for USA. Then I thought of opening a clinic. Finally, she said bye-bye and I was into depression. So the next level is, I need to come back in the second half, right? So it's an interval band. So I have a plan. So all these depressions and everything has eaten away 1.5 year, 2 years of time. And I have restarted my preparation, cracked the entrance, joined the MDS, started so many things because I was so frustrated. I want to be successful, because as you are not successful, people will not consider you as a human being itself. Leave about it. If you are failure, you are not human being according to the society. This is the true nature of a society. Society only talks with the people who are successful. Society talks with the people who are doing good only. Society will not ask anything or will not talk with anyone who is not successful or who are nowhere on the screen. Trust me, it can be any level. You can see any politician who's long back doing extraordinary. For example, you take Andhra Pradesh CM, the old CM, ex-CM, Chandrababu Naidu, almost ruled for more than 15 years. Now he's nothing. Until he wins, he's nothing. So this is the true nature of the society. So none of my batchmates, none of them has considered me as a human also. So finally, I decided, okay, I want to prove. I have talent. Okay, distinction candidate will definitely have a talent. I decided. So finally, I have clicked the restart button, reboot button. Now I decided I don't want my senior to suggest me. I don't want my parent to suggest me. I don't want any of my friend to suggest me. I know what I am good at. I know what I can do. I know everything about me, because the best person to know about you is you. The most important person for you in your life is you. Yes, so some of you may tell that my father, my mother, my brother. Okay, please underline the word. In every word you are telling my means you are coming first. Then your father or your mother is going to come. So this is a true reality. I started after lots of difficulties and failures. I restarted the things. Basically, I thought to open a single chair clinic in my hometown. If my father tell us on that day, I used to have a single chair or double chair clinic in my hometown. Hardly we have some 5 or 6 clinics in my hometown. Okay, so I planned for this. My parents did not accept it. My friends did not accept it. None of them accepted it. So finally, after a hard work of 6 years, completed my PG in Endo department, and God has planned something extraordinary for me. And my journey is like this. So till the date, in the last 8 years, I have trained more than 10 to 12,000 students in a right direction. I tried my best. 10 to 12,000 students, and I have students throughout the country. From Jammu and Kashmir to Kerala, Assam, Mani, everywhere I have students. I'm very happy for that. And finally, this is what my clinic is. Okay. So I thought of opening a single chair clinic in a village, in my village, but I have opened a clinic in the capital city of my state. And And my clinic is the largest microscopic dental clinic in the entire country. India's largest microscopic dental clinic. We have 6 microscopes attached to every chair. And we are doing very extraordinary. No, it's very simple, because if I used to follow my friend or someone XYZ, maybe I may be somewhere. I may be happy to. I'm not bothering about my seniors or someone. I may be happy to, but after lots of failures by the suggestions given by the people, what I decided very simple, that I need to write my own diary. Your story has to be written by you, not someone. Okay. So then the realization came. Then I started my journey. So I have opened a microscopic academy too after my journey, and I have done lots, and I have so huge plans in the next 5 to 10 years. I will be extraordinary. I'll make sure my students will be extraordinary. I want to do something for the dentistry, because I'm a dentist. I want to do something for the dentistry. So this is what I have decided. So I have never left hopes. I am not bored of what I'm doing. I will always give a try. 2012, 2013, I am like you, in a college like you. Maybe few of you are from my UG college, few of you are from my PG college, and few of you are in a far better colleges than where I have been, where I was being. Okay. So this is what my journey, and what I learned from my journey is, you can take suggestions from the people around you, but you don't have 100% right to implement them in your life until you decide that what you want in your life. So finally, welcome to the team Conquer. Okay, so I'm the lead of Conquer. If you want to travel, or if you want to go ahead in the next upcoming few years, I'll give my best to help you out in whatever way I can. So all of you has this confusion, what after BDS? Okay, does your past have an effect? No, I will tell that past doesn't have any effect, because past I was so bad. Quitted my preparation in the middle, quitted the clinic in the middle, quitted the plan to US in the middle, because when I was preparing, there were so many people who has prepared and they were done with their masters. And I was there in the clinic. So many people were there in the clinic. They are doing good. And I was planning to USA along with me. There were so many people who has planned for USA. They were in USA, and few of them are already done with DDS. So everywhere, the people who has shared the journey are successful. Very few people were out of scope, but most of them are successful. So what I can tell you is, past doesn't have an impact. It may influence, but doesn't have an impact. So remove your past, work in the present, and plan for your future. And what I strongly recommend you is, a goal without a plan is just a waste. Like, for example, like few of you may plan for a weekend trip or a weekend. Your goal is to go for a trip, but you should have a plan to reach your trip. So planning is very, very important. So, and I strongly believe that most of us doesn't have a planning itself. Someone has to plan for you. Your life, someone has to write, okay, go like this, do like this, marry this girl, give birth to 2 kids, join them in these 2 colleges. Everyone has to come and tell me. At every level, someone has to come and tell us that do this, do that, do this, do that. Parents will come. You have to be in this place only. You have to be in this college only. Do this department only. This college only good. Someone has to write your story, or you will write your story. You decide. So keep a goal. Any goal. No limitations. Sir, I don't know this. I don't have money. I also don't have money. I'm very horrible situation. I was not in a position to pay my MDS first year fees also. At that time, probably like 7 years back, I was so horrible financially. So don't come and tell us, do this, do that, do this, do that. Financially low, I cannot open a clinic, so I'm planning like this. No, don't underestimate yourself. First, see what you're good at. Start working on those areas. What are the options left over? Start working on those areas. Be serious in your life. Life is only once. Once it is done, it's done. So be serious in your life. Be serious in your profession. Okay, so I want every one of you to become a good dentist, not dentist. All of you are dentists. I want you to become a good dentist, great dentist. Good dentist, great dentist is different from a normal dentist. So many of us ask, sir, dentistry is saturated. Yes, dentistry is saturated, but not good dentistry. How many of you accept this statement? Dentistry is saturated. Yes, 100% is saturated. Good dentistry is not saturated, yaar. Good dentistry is not saturated. Good dentistry is always open. Can you tell me how many of your college teachers or your college PGs can do a proper, perfect smile design? Good dentistry is not saturated. I want good dentists. I want good teachers. I'll give a job. Come. If you're a good dentist, we are there. You are a skillful dentist, you are there. Doctors are there. We need good dentists. We need great doctors. We need good doctors. Yes, that's what I'm telling. Every one of you target to become that. It's not mandatory that you can be, but you have to give a try. You should not keep some limitations, some box limitations for your growth. For example, you take a fruit, keep it in a box. The fruit cannot grow beyond that box. So first leave the limitations, leave that the discrimination part. Okay, I am from village, I cannot do anything. My parents will not allow me to do anything. I should get married. My husband will not do anything. My husband may not help me to do anything. The people around me will not help me. Don't. Why you are asking someone to help you? You do something. Keep on doing, keep on doing, keep on doing, keep on working. One day you will be star. So for that, what should I do? Next question, sir. Okay, lots of things you have experienced, but in this 10 years process, okay, what should I do? First principle of life to be successful is trust. You should have 100% trust on yourself. And trust depends upon these things. One is consistency, constantly hitting the same area. Keep on working. And make sure if you keep on working under the time, means in the lesser time. Okay. So if, for example, like, sir, I want to crack an entrance. So next question for me is in how many years you want to crack an entrance? Most of you will answer it, sir, within the next exam. So means you should get that consistency and hard work in very less time. So trust is inversely proportional to time. The less the time you are mastering something, the more the trust you are going to build. Do you accept this? The less the time you are mastering something, you are learning something, you are practicing something, you are achieving something, the more the trust you are going to build on yourself. The more the consistency. Sir, whatever it is, let my marginal reach break down. Let my root canal fail. I keep on doing and practicing. I'll practice the extractions. One day, after doing 100 extractions, you will get the trust. Yes, I can do this. I can make it. Okay, right? So this is how what you have to focus on, right? So trust, consistency, and time are the important things that you have to focus in the next few years to be best in your profession. So I hope you know this. You know this? Guys, you know, like, I hope you're familiar with the cricket. Cricket is one of the craziest thing. Okay. So hope you know this, like, so this is the recent one-day World Cup. Okay. Long back happened. This marginal error has ended the career of the best player of the country. The best player of the country, whatever it is, the best captain of the country is Dhoni. Okay. It has ended the career of an individual. He's just shot. I don't know whether they're going to take the World Cup, even if he crosses that, but people will consider he's just shot. And same thing happened in the same World Cup in the final. The New Zealand has not registered the World Cup till that date because they were shot. The final match was a tie, and followed by the super over is also a tie. And finally, England has won the World Cup. So this is the best example what I can give. There are few cases, like situations where we'll be short. Okay, the best example what I can give is most of you are short by few marks. So that is the reason why you are in BDS, or else you would be in MBBS. Okay, so the first thing is first differentiate whether you want to stay in India or whether you want to stay abroad. So the next one is how much amount you are going to spend. If it's abroad, how much amount you are going to spend and how much time it's going to take. So these are the two parameters that you have to consider for every step in USA. And of course, the person who is able to balance this time and money is who? Who is going to balance this time and money? In India, particularly in India, who is going to balance this time and money for you? Come on, I want you to answer this. Yes, so this balancer is your parents. Okay, so before you take any call, okay, so particularly abroad calls, you have to sit with the parents and explain the consequences and explain the financial limitations and explain the time limitations. Then only you have to take an abroad call. This is my personal suggestion for each and every one of you. Next one is, before you're taking any sort of option of abroad, think about the negative side of the options. So negative side of the options you have to decide. Means what are the disadvantages of taking this option? But once you lock to an option, once you are fixed to an option, you always think about the positive side. Clear? Is it clear? Best example I can give you, if you are planning to get married to a particular individual, think about the negatives, bad qualities in the individual. But once you are married, now think only about the positive side. So this is something like that. You decide the goal, but every goal has some negative side. Okay, think about the negative side before you take the call. But once you are fixed, think about only the positive vibes and positive side of the particular call. Let it be USA, let it be India, or let it be anything. Next, how can you do MDS? I'll try to be a bit fast. How can you do MDS? In India, you have two options to do MDS. One is Neet MDS examination, in which 98% of seats in the country will be filled. Second one is INI CET MDS exam, in which 2% of the seats in the country will be filled. So INI CET has only association with AIIMS, PGI, and JIPMER. And in PGI and JIPMER, you have very less number of seats, total together 10 per year. AIIMS is going to turn somewhere around like 25 to 35 per year. And rest other seats, your college, my college, GDC, all colleges will come under Neet. So these are the two exams which you have to clear to enter into MDS. I hope this is clear. So Neet and INICT are the two exams which you have to write to get into MDS. Next one, how many GDC seats are there per year in India? Anyone can answer? How many GDC seats, government dental college seats? I'm not talking about all seats. I'm talking about government dental college seats. Government dental college seats means colleges which are associated with metropolitan cities and colleges which has free seats. These are free MDS seats. Okay, these are free MDS seats. Okay, so how many seats are there in India? Around 500 to 550 plus GDC seats are there. 500 to 550 government dental college seats are there in India. Now, how many seats are there per year in your particular state? Okay, so I'm going to list out few important states where most of your students are from. Rest others, if you want, you can ping me on my number on the WhatsApp. I'll send you the details of your state. So for example, I hope most of Andhra students are there. So these are the number of government dental college seats in your particular state. So you have Vijayawada GDC. It's having 3 perio department, 3 in oral surgery, 3 in endo. So total 9 seats are there in Vijayawada. And Kadapa RIMS is going to have 3 radiology, 2 prostho, 3 endo, 3 ortho, and 3 pedo, and 3 oral surgery, and 3 perio. You have more seats in GDC Kadapa. So these are the number of seats available in state of Andhra. So jumping into state of MP, I think MP students were not there. Few of the, okay. So MP, you have these following seats. You have GDC Indore, which was started very recently. For MDS, they have started recently. They have increased the seats also. So these are the number of seats. 1, 2, 3, 4, 5, 6, 7. 21 plus 8. 29 seats are there in GDC Indore. And coming to Telangana, you have only one government college, that is GDC Hyderabad. So GDC Hyderabad, you have 1, 2, 3, 4, 5, 6, 7, 8, 9. So you have 27 seats in GDC Hyderabad. And followed by Karnataka people, GDC Bangalore is there. So 1, 2, 3, 4, 5, 6, 7, 8, 9. You have 27 seats in GDC Bangalore. Coming to Maharashtra, GDC Mumbai, you have many GDCs. Highest number of government dental college seats in the entire country are there in Maharashtra. So you see GDC Mumbai, you have 20, 30, 40. You have 50 seats in only one college. GDC Mumbai is having 50 seats. Similarly, GDC Aurangabad is there. 1, 2, 3, 4, 5, 6, 7, 8. You have 24 seats in GDC Aurangabad. And coming to GDC Nagpur, again from Maharashtra, 1, 2, 3, 4, 5, 6, 7, 21 and 23 seats are there in Nagpur. And GDC Nair Mumbai, you have 1, 2, 3, 4, 5. You have 63 seats in GDC Nair. Okay, so Maharashtra is having the highest number of seats. I hope you I'll post these details on your respective groups. These are the number of GDCs where most of your students were focused on. So, I mean, like, for example, if you're planning your preparation for next year and your internship is already started, and if you finish your internship by December 31st, 2023, you're eligible for this examination. That is your INICET November 2023, your first examination it's going to be. So this examination is going to include 15 seats, and the examination is for 200 marks, and it is for 3 hours. Exam is for 3 hours. All your exams, INICET, Neet, both are 3 hours only. And negative marking is -1/3, means for every right answer, you'll get +1 mark. And for every wrong answer, you'll get -1/3. And you have to solve each question in 50 seconds, and you'll have diagram-based questions also here. They're going to give an X-ray, clinical photograph, and they'll ask you the diagnosis, or they can give you the instrument. Similar like your spotters in your oral pathology, oral medicine, surgery, perio, all these departments, they keep some spotters. Those are nothing but called as diagram-based questions. So regular questions will be 160. The different pattern of questions will be in and around like 50 to 20. So the different pattern of questions are basically your assertion and reason-based questions. Match the following, true or false, and multi-option questions. Okay, so arrange the following in ascending order, descending order. Such questions are there, the newly added questions. So this is your INICET November 2023 eligibility criteria as of now. It may slightly modify. Is you need to finish your internship by December 31st, 2023. Then you are eligible for this particular examination, which is going to be in November 2023. Before you complete your internship, only the exam will be there. The result will be out, and the college is going to start from January 2024. January 20. So if you complete your internship immediately without any break, like probably by taking a 1-month break, you are going to join the college immediately. The next exam that you are eligible for is Neet. Dates may vary slightly. Okay, it may be in Jan, or sometimes they may postpone to March, similarly like this year. So it will be March or January 2024. The eligibility criteria mostly will be March 31st. So the eligibility criteria is March 31st, 2024. By March 31st, 2024, you have to finish your internship for eligible for this examination. What seats are included in this? All GDC seats, private college seats, Army Dental Corps, even Army Dental Corps selection, all deemed colleges, everything except AIMS, PGI, JIPMER will be filled through this. The number of questions will be 240. INICET 200 only. This is 240. Time duration is same, 3 hours there, 3 hours here. Here, negative marking is -1/4. INICET is -1/3. Means every right answer, you will get +4 marks, and every wrong answer, you will get -1. So here you have to solve each question in 50 seconds. Diagram-based questions will be somewhere around 35 to 40. You have lengthy clinical case-based questions also. So this is a rough outline of both the examinations. Okay, I'll post this recorded version. If you want, you can watch it again, or I'll post this blueprints and everything in your respective WhatsApp group so that you can check whenever you want. And if you want to give one more round, because INICET will be done twice in a year. INICET is 2 times in a year. Neet is only 1 time in a year. Okay, so immediately in the May session, you will have one more round of INICET. The contents will be almost same. Normally, November INICET, you will have only AIMS. May INICET, PGA and JIPMER will also be added. So that is the reason why seats will be comparatively more in May INICET than November INICET. Rest everything same for both the INICETs. So this is the blueprint that is given by NBE people. National Board Exam people has given a blueprint for Neet MDS preparation. So this is a blueprint, and most of the subjects are going to carry 14 marks, 14, 14, 14, 14, 14. So here they have splitted physiology and biochemistry together 14. General path microbiology together 14. Oral medicine and radiology together 14. Cons and endo together 14. So all subjects are going to carry 14 marks, and totally it's going to be 240 score. And what books you need to follow. Okay, so of course, like if you're a part of MDS Conquer, we are going to give you the power play books. Okay, and I strongly recommend either to pick Dentist 7th or 8th clinical volumes, or you can buy the Dental Pulse. Okay, whatever, any of these books. And few students, they read both the books. Nothing wrong in reading both the books, but you should differentiate the common content in both the books, and you have to exclude that during the revision part. That I'm going to help you. And you have to do all the question papers from 2017 to 2022 that are available on the website. Now, this year we are planning to increase this from 2010 to 2022. All old question papers will be there. Whenever you want, you can solve. You have a question bank that is being added to the website, which is totally different from last year. And all latest concepts, you will have a videos, and you will have smart notes on the website. You will have last minute revision on the website. You will have mock exams, you have textbook reading. So everything, so whatnot, everything are included in this particular pattern. And this is, I strongly recommend, whether it is INICT or Neet, I strongly recommend. This is the best checklist you have to, because you have to keep a limited preparation material so that you can revise this n number of times. Revision is required from all the directions. Revision is required in n number of times. Next, so this is all about MDS. So the second best option, if you want to stay in India, apart from the academics, clinic, opening a clinic, working in a clinic, XYZ, all the stuffs, the common stuffs are there. I'm trying to be more going with the more professional stuffs, and of course, few people are asking. So there is something called as Army Dental Corps. Okay, so the initial pay for Army Dental Corps touches around 95 to 100K. That is around 1 lakh. Let consider it as 1 lakh, around 1 lakh. Okay, so Army Dental Corps every year they are going to pick some 30 to 35 vacancies will be there. Sometimes more, but mostly it is 30 to 35 vacancies. For this, you have to clear round 1. The round 1 is Neet examination. So you have to get a very good rank in the Neet examination, followed by which you are going to apply with your Neet examination, and they are going to keep a cutoff. And the second round is going to be an interview followed by medical examination. So finally, after finishing these two, they are going to release a final merit list. That final merit list, if you are standing in the top 40, there are high chances that you can enter into Army. Clear? So this is about Army Corps. First, you need to enter into Neet. But twist, 2021 before Army Dental Corps is different. 2022, I don't know about 2023, but 2022, what they have done is they have kept a quota differently for a male and a female. Previously, we don't have a quota of male and female. Okay. Recently, this is launched in 2022, last year only. So they have kept only 3 openings for female. Female, 3 openings. More openings for males. Okay, more openings for males. So the cutoff will be different for female and the cutoff will be different for male. Last year, the cutoff for female was around 250 All India rank, whereas cutoff for male is around 2000 All India rank. Okay, so the cutoff has varied. This is the first time that has happened. Whether they are going to stick on to the same rule for the next year, that is 2023, or whether they are going to modify the rule, I don't know. We don't know. As of now, we don't know. We don't have any proper information on that. We need to wait for that. But before 2021, common cutoff for both male and female. Okay, I hope this is very clear. Step 1 is Neet, good rank. Then if you are in the first merit list, then you can go for an interview followed by the medical exam. The salary turns to be around 1 lakh, and you will have all the opportunities. Like this is a gazetted post, you will have all the allowances like Army people are going to have. The next one is, I'm going to talk a little bit of 5 minutes about INBD. So INBD is an international board examination, which is done for your DDS. So steps in INBD, the first and foremost important thing is, first you need to send your documents for EC evaluation. You have to send the documents for USA, and followed by, after EC evaluation, you can generate a dental pin. You can generate a dental pin, followed by the generation of dental pin. Okay, you will get a pin, you will get a number with which you can book the slot for the exam INBD. So previously we used to have NBD part 1 and part 2, followed by NBD part 1. After you pass part 1, you have to give part 2, but now it is being shifted. Okay, it is being shifted. We have only one exam called as Integrated National Boards exam. So you have to clear this examination. Once the exam is cleared, you have to build your profile. Profile is something like, in a simple word, CV or a biodata, with all the recommendation letters and everything, you have to apply for every university. So if they like your profile, they are going to call you for an interview. Interview followed by bench test. If you qualify this interview followed by bench test, then you will be given the DDS. Okay, and DDS is, it varies from university to university. So somewhere around, like, it is 2 years, 4 months course. and you'll have a waiting period of 6 months after getting an admission. And the waiting period here varies. For a UGs, it will be more. For a postgraduates, the waiting period will be less. UGs, it may take 2 to 3 years waiting period here. For a PGs, it ranges from 1 to 1.5 years. The few of my seniors have cracked in 1 year, less than 1 year also. Okay, so this is a rough plan. So what is that? First, you have to send your documents, dental bill generation, then INBD examination, then profile built up. Then you have to apply for the universities. Then they are going to call you for interviews and bench test. Then you have to finish your DDS. Then you have to come and do the job. They're a bit expensive and time taking. The only issues are expensive because DDS course itself is going to cost 1.8 to 2.2 crores of Indian currency. Okay, so it's going to be expensive and it's going to take away time. If you can overcome those two barriers, this is a very good option. Okay, so that's all about DDS. So dental PIN, INBD preparation, you can start in India itself. Okay, so bench test, you have to go to USA and write this INBD, followed by the next steps also, you have to go to USA. Every step has to be done in the USA. So next one, there were a few people asking me about Canada. Or say Canada, Canada, I think if you are planning to go for masters, the story is going to be different. But I'm talking about more often related to dentistry. I'm nowhere interested to talk about dental hygienist. Okay, dental hygienist is different. Dentist is different. Okay, so dental hygienist is you are going for a low profile thing. But so in Canada, if you want to go, if you have two options in Canada, one is you can go for DDS in Canada. Canada also DDS is providing DDS is also provided in Canada also along with USA. But number of seats and chances will be very, very less. So that is the reason why if you want to do DDS, definitely USA is going to be the best option. The next one is Canada is going to have an equivalency examinations. Equivalency processes. So you will have an equivalency examinations where you have to clear a series of examinations. And to start this processing, you need to spend somewhere around 1,000 to 1,100 Canada dollars. Okay, followed by the first part in this is you need to finish. First exam is AFK. The AFK is something called as Assessment of Fundamental Knowledge. Assessment of Fundamental Knowledge is the first step. And the processing fees is around $800 to $900. And this occurs 2 times a year. If you fail once, you have to wait for 6 months to give the exam again. So once you're done with the exam, you have to go for the second examination. That is ACJ. ACJ is nothing but Assessment of Clinical Judgment. And the processing fees for this is $1,300 to $1,400 US dollar, Canada dollars. And this also occurs 2 times a year. Then once you're done with the second exam, then you need to move to the third exam. That is ACS exam. That is called as Assessment of Clinical Skills. This is a practical exam. Assessment of Clinical Skills. And you need to spend somewhere around $9,000 to $10,000 for this. So once you're done with this, then you have to go for the next level. What is that next level? You have to go for Ndbe certification. And the processing fees for this is $450. Here you have 2 parts. Part 1 is a written exam, which is going to be $1,000. And part 2 is OSCE. OSCE is nothing but called as Objective Structured Clinical Examination. Objective Structured Clinical Examination. So this is again $1,000. After clearing this, you will have license to work in Canada. So this is Canada is a multi-step. You need to clear multiple steps and lots of examinations has to be cleared to get license in Canada. So it is going to take time. Apart from money, it's going to take some time and it's going to require so much of hard work. This is the outline to get license in Canada. Next one, there were a few people asking about UK. UK, there are 2 modes of pushing the people. Okay, the one mode is ORE examination. That is Overseas Registration Examination. Second one is LDS. There are few people nowadays writing this LDS. LDS is Licensed Dental Surgery Examination. Licensed Dental Surgery Examination. So one part is this, one part is 2. This is tough. Exam pattern, this is tough. And this is a bit easy. comparatively easy. Okay, and all these examinations will be done in UK and London only. Okay, so here you will have two parts. One is a written exam, and second one is a practical exam. In this written exam also, it will be done in part A, part B, or it will be done in one day, first day and second day. So first day you will be having basic sciences, and second day you will be having clinical sciences, more of application based. And this examination, ORE examination, will be done 2 times an year. 2 times a year. And the most difficult part of this ORE examination is booking a slot. Slots are not available. Okay, the slots will be open and the slots will be closed within 10 to 15 seconds. So you should be ready. They are going to tell you at what time they are going to release the slots and what day they are going to release the slots. So immediately at the time, you have to be ready to book the slot. If the slot is lost, you have to wait for 6 months for the next round to get your slot booked. Okay. So these are the 2 examinations. This is done by the authority that is going to done this LDS is Royal College of Surgeons in London. They are going to conduct this examination. So any of these examinations, if you clear, you can practice in in UK. There were like 2 of my seniors when I was there in UG. As of now, they are practicing, and one of them has recently opened a clinic also. And in my PG, one of my immediate junior right now done with LDS. And she was just waiting to clear this ORE. And recently she was not able to book the slot. She was more worried about she lost the slot. So she's waiting for the next 6 months to clear the ORE. And she's from UK. And if time permits, I'll definitely make a live session with these people, like people who has recently entered into DDS or done with DDS, or people who are written this ORE and everything. I have a decent number of my close friends and seniors and juniors who have done this. Then I'll be talking about UAE. So UAE can be any other countries like Saudi, Oman, Qatar, your Dubai, and all these things. Nowadays, what has happened is they're trying to replace the BDS staff by MDS staff. Now the rules are a bit strict. Unless you have someone who is doing MDS, who has an MDS tag. And for example, if wife and husband, husband is MDS or wife is MDS and husband is BDS, then you can think of going to UAE. But openly now they are not allowing the BDS people to work in UAE. Okay, so because I have in the last batch, I have many of my students who used to prepare from there to clear the MDS. And recently in Karnataka, there were like 2 or 3 people who has joined. Okay, they were like, their age is almost like 45 years. They're elder to me. Okay, they work 15 to 18 years over there in UAE and Saudi and all these things. And recently they came back to finish their MDS, and again they want to go back because nowadays they're replacing the BDS staff with MDS staff because both are getting at the same cost. Okay, but that's what I'm telling. Whatever you're going to earn in UAE is going to be 2 to 3 times more than what you're going to earn in India. Like for example, if an endodontist is making 1 lakh per month in UAE, they're going to make 3 lakhs. That 3 times revenue. One of my immediate senior now she's making 4.5 to 5 lakhs per month in Saudi. Okay, I'll definitely try 100%. She's very interested to interact with you. Probably within a month, I'll definitely plan a live session Instagram with her, so you can interact with her directly. She's doing extraordinary. She is doing very, very good. That is what UAE requires MDS, and not immediate MDS. They require 2 to 3 years experience after MDS. Means after finishing MDS, you need to have a 2 to 3 years clinical practice. Then if you have any plans to make more money, because most of the people who shifted to UAE, their target is to make more money, earn more money because of the financial limitations. And of course, the quality of treatment is definitely good compared to here. Similar options are there in Malaysia too. You may not go for a clinical practice in Malaysia, but you can work as an academician in Malaysia, and the salaries are again like 1.5 to 2 times more, double the earnings in India. There is 3 of my batchmates who are working in Malaysia University. And of course, we have a staff, the perio staff from MDS Conquer. He used to work here. Now recently he has shifted to Malaysia. We'll definitely keep an interaction with him. That is very feasible for us. In the next few days, we can plan an interaction with him, no problem. Okay, so whatever may be the step and whatever may be the things, the preparation is always the same. Okay, the preparation is always the same. So how do you start anything new? How do you start anything new? Guys, hope you have done this cycling and all these things. You start practicing. So in the initial phases of your practice, so there will be lots of difficulties. that you have to accept those difficulties. You have to accept those difficulties. So starting is always difficult. Okay. So thing is, you need to find the key things when you're starting the preparation or when you're starting anything. You need to talk with the mentors. DHA, that is going to take lots of time. This is not the session to talk about UAE examinations, because every every territory is going to have a different examination. Okay, they're different board. For a UG, it's a different examination. For a specialty, it's a different examination. That's going to take a long session. If you have any such things, we'll talk about that when we have time about that. So just a second. Okay, so so anything, it's going to take time. So like how I explained my story. So in the initial phases, I faced lots of difficulties. I don't know whether I'm doing right or not. Once I have started few things, I felt it is wrong. I failed. I came back, because at that time only, I used to have my friends in Dubai. I used to have my friends in different countries. So I checked out all the opportunities for all the countries before I take a particular call. So few things I skipped because I'm not fit for this. Few things I have taken a call, but they doesn't suit me. I failed. So it's all about, like, in the initial phases, you have to choose the options well, or you need to sit with someone who has a better knowledge over this, and you need to talk them, and you need to take their help. Okay. And you need to start the proceedings. Okay. So learning is difficult always, but once you master the learning, the things will be easy and the things will be very, very simple. So that's what I want to conclude. So starting problem will be there, but if you keep works hard, like you have that rule of 21 principle, every new habit or every new thing, whatever you're starting, it requires some practice for 21 days. So there were few people who start the preparation without finishing those 21 days. First 5 days only they will decide, sir, I will not get a seat. I cannot read. I cannot survive in dentistry. So don't come to conclusions just by reading 5 or 10 days or just by reading 1 or 2 months. You need to talk with the right person, sit and talk with the right person. Everyone cannot be a topper. Topper means always one. All India one means only one person. State first, only one person will be there. So every time you cannot be that one. You may be that one, but you cannot be that one. It doesn't mean you are not going to end. If it is the only all India topper or state topper can survive, only few people will be there in dentistry. Okay, so the point here is you have to focus on your abilities. You have to start working on them, and we'll see what are the possibilities. Let's talk with the mentors, interact with the mentors frequently, then you can find the solution. And second one is the most important, is time management. How you manage your time. So many of the interns, they come and tell me, sir, I'm doing this, I'm doing that, I'm not able to have time, I'm so strained. And no, I used to manage MDS Conquer when I was there in first year MDS, second year MDS, third year. I feel like MDS PG people will be more busy than an UG people. So it's all about the illusion. You have that illusion that I cannot do. Remove that illusion, come out, talk with the people who can give that positive vibes to you, and you can definitely fetch those things and make the things on track. And we are there to help you. The only thing is, what I can assure you is, we are always there to help you at any time, at any position. Okay, so coming to the courses which are more effective with high percentage. So MDS Conquer, for MDS, we are going to provide these courses. Already browsers and everything are given to you. Again, I will be sharing this. We have Plan A and Plan Pro. Okay, so the difference between Plan A and Plan Pro is the live Zoom classes. As of now, we are having 1 class per week, but probably once your seniors are done with their March 1st examination, we'll be having 2 classes. That is the only difference. And you will have access to the recorded version of this live class also in Pro Live. Okay, and everything is common for both the plans. Okay, the only difference is Pro Live is going to have extra live classes, and of course the state toppers and all India toppers, most of them are Pro Live students, because if you take Plan A is going to be monotonous, means it will be only one-way preparation. If you take a Pro Live, you'll have that interactive sessions very frequently with the mentors, so you can maintain that active mode of preparation. Plan A I strongly recommend for, like, I got a message, I'm a mother of 2 kids. So mother of 2 kids, they may not allow you to sit for a longer duration in a live class, and they will not allow you to hear. So I suggest for a mothers, or for the people who are preparing from UAE or people who has their own clinics, or people who are working in the clinics, because they cannot come and attend the sessions of live, which will be from 6 to 8 o'clock in the evening. 6 to 8 o'clock exactly you have to come, or else you have to again hear the live recorded sessions. Okay, so such people who are at a different timeline, I suggest them to go for plan A, or financial limitations or anything XYZ, because a few students, they may be part of other coaching center also, they may have a different schedule. So I recommend them to go for plan A, the regular practice and everything. That is useful, videos are there and everything, you can watch them. But if you want to be more focused or more dedicated or more streamlined to the team, I recommend Plan Pro, because you will have that interaction with the mentors. You can talk with the mentors. Of course, Plan A people can also talk with the mentors. We don't have that barrier. But thing is, you see a mentor like this. This is a live Zoom class, something like a live Zoom class. You will have a similar classes like this every week. 1 or 2 classes will be there in the Pro Live, which are not there in the Plan A. That is the only difference. Rest everything will be same. Okay, and of course, offline Hyderabad center is there where you can have your live sessions. You'll have that online access. Along with the online access, you will have that offline facility also. Okay, you'll have study room access, AC study room access 24/7. Library access will be there. And the advantage of the Hyderabad offline is you will have a mentor every time. You will have a mentor. You're going to have a mentor every day. Okay, one or other mentor will be there in a particular duration of time to interact with you, to clear your doubts or XYZ stuff. So these are the 3 plans that MDS Conquer is going to provide: Plan A, Plan Pro, and offline. I hope, like, if you are far away from Hyderabad, then the only option is either to go for Plan A or Plan Pro. So these are the Hyderabad offline center photographs. So I'll share all these things. All these things are there in the brochure, or offline centers. So apart from that, I told you, right, we are conducting international examinations also. So we have bench test program course also, international exam or clinical orientation program with lasers, microscopes, all modern dentistry, rotary endo and everything. We have courses about that. We have a 14 days bench test course as well as 14 days clinical orientation course to improve your clinical skills, everything whatnot. Okay, so this is the lab we have. So this is a MDS Conquer previous result. So we are striking the best ranks, single digit ranks every year. Last year we got 8th rank to Telangana intern. Before that we got category state all India first rank, and before that we got all India second rank for Andhra intern, and before that we got all India 4th rank for Jammu and Kashmir student, and we got 3rd rank in 2018 for an Andhra intern. And the last year result, we got Madhya Pradesh state first. Okay, Sadhana has got 22nd rank, and we got Assam state second, apart from Andhra, Telangana state first from past 6 years. Okay, and I hope like most of these may be your seniors, or you may know these faces. Okay, so for other courses, I was talking more specific about MDS and INICET, but other abroad courses, you can contact me. This is my phone number. You can save this number, 9989427971. So this is an information from my side. As exactly, I have taken 1 hour to finish this. So I want to extend my session to the other speakers. I need some time. Just a second. Sahithi ma'am.
Yeah, hi.
Yeah. Just a second. I'm making as an admin. Yes, ma'am. Now you are host.
Hi, everyone. Is my voice clear? I hope it's clear. So this is, I'll just give me 1 moment. I'll share the screen.
Guys, meanwhile, you can drop your doubts on the chat box. If you have any doubts, okay, any doubts, question and answer session, you can drop on the chat box. We'll try to answer once the session is done.
So, hi students. I hope everyone is here. So you can leave a message if the screen is not clear. I hope it's clear. Is it clear, everyone? Is the screen clear? Great. So yes, good evening, everyone. Welcome, everyone. So all our people who have attended today's session are doctors, right? So I would like to start by saying one thing, that you're not just a doctor. Every one of you who is having the prefix of being called as a doctor is having a superpower. Okay, so which makes our profession to be very much noble enough when compared to any other thing. Of course, every profession is equally good nowadays, but yes, the doctors who have been the front warriors even in our COVID, right? Even the dentists have got the very good chance to serve the society during a COVID, right? So we are always having that superpower to treat the pain. So pain is one thing which the patient actually suffers a lot when compared to anything. Okay, so the pain could be anything, either it could be psychological or mental or physical. So we are treating the pain which is related to the tooth or the oral cavity. So we should be glad for doing that. Okay, so one more thing I would always keep on saying, I've heard from one of my professors who said that you should be very much glad to be called as a dentist or a doctor who's having an MDS followed by that. Why? Because we are treating the tooth pain. Okay, so tooth pain is the third most severe pain in the world. The first pain being the labor pain, the second pain being the pain which is related to myocardial infarction, and the third most severe pain is a tooth pain. So we all are lucky enough that we are treating that, okay, or we are about to treat the oral cavity related issues. Okay, so myself, Dr. SAHITHI, I'm into the team of MDS Conquer from the past 6.5 years, 6+ years. And I've done my master's in oral medicine. So I've done my BDS from Usmania, from GDC Hyderabad, and MDS from Vishnu Dental College. And I'm into the team of MDS Conquer, and I'm handling the MDS aspirants from the past 6.5 years. So yes, so welcome you all. So what I would like to start is, so the world today is like, now if you call me, what is the world today? So it is like before COVID and after COVID. Do you say it yes or no? So the world is changed like that. It is before and after COVID. So everyone's life is like that. What was your life before COVID and after COVID? So even I would like to explain our team of what all I have went through with my students, or with our students, with the team in this past 6.5 years. So it's like before and after COVID. So initially, from in the beginning of the team, when I was with the team in the beginning years, so we were into this, as you can see on the screen. So we were having a very good official website, so which was handling many of the exams. We would also had daily WhatsApp discussions. Okay, we used to have personal interaction and mentoring. We used to have offline classes. We used to clarify each and every doubt that was posted by the students. And always there was integrated approach of both the medical as well as the dental subjects. So this was the initial 3-4 years before COVID, which we used to do. Okay, starting it was online, and later we have opened the offline center, and in the offline center we used to handle offline classes. But what happened later, as we know, the COVID has entered. So because of which the students couldn't get the chance to come to the offline center because of the situations that has demanded by the government or by the students themselves. So these colleges were closed. The students had to stay at home. They never used to have their books, or because all the books were in the hostels, they suddenly got locked themselves. The lockdown was too terrific. I know everyone has went through that phase. I need not explain how the phase was those days. So we had come through innovative approach towards reaching every student in the remote areas of the country as well. That is via smart notes and smart videos. So even those who didn't have a textbooks with them, who don't have a library, we could do this via our smart videos. So that was the advancement. So year by year, we had like incorporated many new things, so that it did make much difference when compared to the previous years. So during COVID, with us those 2 years, of course, there was daily WhatsApp discussions, there was mentoring and interaction. The website exams were there, having topic specific, subject specific, the grand and the mock exams. Besides that, we have made our website so like phenomenal that it had very good videos. So we had covered some important videos, around 500 plus videos, along with the smart notes for those 2 years or maybe 1.5 years, like that. And online classes we used to conduct via Zoom. So Zoom was a very good app from which came into action during the COVID, as we know that. So via online, that platform, we did take many online sessions. So that was the time then. And once the COVID was fine, and we handled, and everything again went back, the vaccination was there, and all the students were good enough, and they started coming to colleges, and everything was again back to form. Then even we were back to form, and we made every topic specific video. So every topic which is there in your pulse or in your textbook, we have a video on that. So on that, around 1500 plus videos. So that is the latest update in this past 1.5 years that we have done. So we have some 1500 plus videos, and the videos are also in the latest format. Like you will be seeing the mentor sitting and explaining. So you can see the mentor, you can see the explanation, you can see the expressions, you can see everything that's live. So it is not something like bore or something. You will have that feel that you're directly seeing the mentor. So that sort of a new technology was incorporated by our technical team, which really helped us to do so. So our technical team is very efficient, and they have helped us to really do that. So we did that in front of the camera, and we really have improved a lot technically as well. So even the students really liked that, and even they got a very good knowledge seeing those videos. Now from 500, it's 1500 plus videos we have in our website, and that too, most of the videos are in the new format. And anyways, we have the smart notes. And since the offline classes again got started, because the COVID has it's like not much now. So we have many offline students. So offline classes are there every week. At times we have 2 or 3 offline classes. And again, online classes for the pro batch students, as sir explained, it is via Zoom. And one-to-one interaction, but with the offline students, with the online batch, everyone we have through the Zoom as well as through our phone or contact. However they try to contact, we do that. And now latest in this 1.5 year, we have our app as well. So every phone, whoever is the student of MDS Conquer, they can install this MDS Conquer app. Okay, so that is the latest advance. And this from the past, I think 6 to 8 months, we have been taking a lot of live sessions Instagram. So if you open our Instagram page, you can see many live sessions, picture-based discussions, daily spikes, means hardly 30 seconds or 1 minute, nearly 30 second spikes will be there, where you will be given all the memory-based or picture-based content, which you will which will regenerate your memory-based things. So like that, we have planning innovatively day by day. The team is working very hard for that. So this is upgradation that we have done from the past 6.5 years that I am into it. Of course, it is the 9th batch that is going on. So sir has handled the first 2 years. Later, I joined him, and I am into the team. So from my journey with the team, what I have seen the improvement from our side is all this. And especially we have seen the same reciprocation from the students as well, because the students really felt that all that we have done is really helpful for them. And they have given a very good reciprocation and feedback. And we do take suggestions from them, and we are improving day by day. So that is the thing that we have done. And most of the questions that is put forward by any of you could be, what could be the difference of this team with the others? Like there are many institutes across the country, but what could be the major difference, ma'am or sir, you would have asked us. So what is the difference that I can say is, the very first difference is our website. We have an incredible website. Okay, so it's absolutely very student friendly. So it is so easy to use, okay, and it's very good to use. So you must be having a doubt, already many of the institutes or app is also there, ma'am, then what is the use of the website? Okay, so most of the students, like 80 to 90% of the students do have an app in their phone. Okay, but giving an exam in a phone is make versus giving an exam in a laptop or in a computer makes much difference, because you need to have that experience before sitting in front of the laptop or the like touching the mouse and removing moving the cursor. So that experience is different when compared to just giving in a phone. So that makes a major difference, honestly speaking, because um, using a computer and using a, what do you say, the mouse is actually much better. And that exactly the exam platform, how the exam will be, how the time will be, the time lapse, how every question you will be going further, and how the exam will end on time, irrespective if you want to give beyond the time also you can't give. Everything is in our website. Okay, so you will be getting that complete experience through our website, giving exams on website. These videos are smart notes. You can use the app anywhere, anytime, anywhere. But exam approach, it's always via laptop, or if like you have the computers or an internet content in your colleges, or you can have your laptop, because laptop is must in your post graduation. And in the worst situation, you can also use your tab. But this exam, that pro forma, is completely like your final exam. So it's like that. And one-to-one interaction with the mentor is there, which is, I can actually say that no other institute can give it. So any student who approaches us at any point of time, we have that one-to-one interaction with the mentor. Okay, so we have that reach and approach towards anywhere, any student across the country. So that makes the major difference. And the what next are we planning is, we are going to have more video access, like the videos will be connected to the smart notes and to the topic specific exam, which will be easy for you. And on important topics, we'll be handling like 2 or 3 mentors can take a discussion. That sort of new format also we are planning. And also we are planning for the question bank. Okay, so this is the latest thing that I wanted to tell. So yes, so these are the things that I wanted to tell students. So I will be glad if you be the part of our team, because you will be really beneficial. So many of the students have given us that feedback. So I will really happy and glad if you are a part of our team. So yes, Dr. Srikanth.
Yeah, thank you. Thank you so much, ma'am, for all the updates in the history of MDS Conquer. So now I want to move to the next part, that is Sir is waiting, Gauri Shankar Sir is waiting. So he's going to talk about a few positive words, what I really require, because Sir is basically a HOD. When I was there in third BDS, I told my story, right? Sir also has a major part in my story. He was my teacher when I was there in third BDS, and now I'm very glad that he's a part of Conquer. And of course, lots of wisdom, lots of knowledge, experience grows, the knowledge comes. So my knowledge, my wisdom is nothing before him. So he is here to give some more motivation for me, my team, and as well as for you. Sir, the session is hand over to you, sir.
Thank you, Srikanth. Am I audible?
Yes, sir. Yes, sir.
Yeah, thank you, Srikanth, for your nice words of introduction. And Srikanth, can you please enable me for share screening?
Ma'am, Sahithi
Screen
ma'am.
sharing. Okay. And Happy New Year to all of you. I'm happy that all of us gathered here to discuss about the MDS PG entrance preparation. I'm very happy that this year I am joining this MDS Conqueror group. I have seen Srikanth nurturing as a student to a master who is guiding all the students to the MDS seats. It is not exaggeration if you see that most of the government seats in Andhra Pradesh and Telangana are from our MDS Conqueror. But I want to see that most of the seats in all India should also from our MDS Conquerors.
We will do that, sir.
Yeah, thank you. And as Srikanth explained, now I am moving why you want to do PG. Hope all of you wanted to do PG and join here. He has explained you the different avenues available to you as an BDS graduate. Srikanth, can I share the screen?
Yes, yes.
Okay. So as explained by Sahithi ma'am, there are different methods, technologies of education system introduced by MDS Conquer. I used to appreciate during his student life only. He has utilized the WhatsApp method. Even though I am not before the scenes, I was always behind the scene, finding out the questions he has posted in the groups, and I will be interacting with the students, Srikanth. Whether you know it or not, I'm very much interested, and really I accepted when you have given me this proposal to join the MDS Conqueror. And definitely we will try to improve the heights, we'll try to raise the heights of MDS Conqueror. And I promise you there will be definite the discussions, and whenever, as far as I remember, when I used to teach these coaching methods, I think it is around last batch I taught is 2017 or 2016. And I promise you, the students, you are free at any time to disturb me. Even during 2 o'clock, I used to get WhatsApp messages, not only in Arco, and you can post me any doubts regarding the entrance examination or guidance, anything. I'm very happy to join Srikanth. So why we have come to join MDS here? So basically, we are BDS. BDS is a basic degree. It doesn't have specializations. So at most thing any person want to achieve is to achieve a scale, new scale in this profession. So wherever you go, MDS is a must. It has become a qualification. Whether we accept it or not, nowadays all the corporate hospitals or other institutions, they're asking for MDS qualifications. Not only MDS qualifications, you should be well skilled. Srikanth, is it enabled screening?
Sahithi ma'am.
Screen enabling.
Actually, I'm just trying to do, just a second.
Okay, no problem. Okay. Srikanth, all of them are from AP or Telangana?
So we have students from every state, sir. We have students from every state.
Every state. Okay. And definitely we'll see a change in the pattern, how we are going to lead this 2023 to 24 batch. And
sir, I hope now you.
Yeah, sir is the host now.
yes.
Yeah.
I'm able to share my screen. Is it visible?
Yes, sir. Yes, sir. Visible, sir.
Yes. This is what I used to tell my students: fast and steady, not steady. Not only STUDY, STADY wins the race. That is very important aspect after BDS for MDS preparation. And why I put preparations is there should be a 1% aspiration if you perspire 99%. That's aspiration. I've seen only a few persons can give it. And of course, our Srikanth is one of the persons. I appreciate you, Srikanth. And remember, there is always room at the top. What the thing you have to do is the hard work, perspiration. Only maximum we can aspire you to 1 to 5%, and remaining is your hard work. And another thing is, when I was discussing with the students, I always interact with saying them, remembering these two fellows, great fellows. One is the Charles Darwin and another is the Newton. Why I'm talking about, why we are discussing all this is there is a lot of competition has increased. So due to the increase in competition, there is what called a struggle for existence between us. So those who are fittest will survive in this competition. So take it granted, we make it fit, we make it prepare you for any type of entrance examination in India. We want to see that our MDS conquerors should be in first 10 places in all the entrances from this 2023 to 24 batch. So up to BDS, life is something different. You are in a pouch of safety like kangaroo, but you have to create a momentum. We will create momentum to prepare you for entrance preparation, which will give definitely action you have to take, the third Newton's law. And the reaction will be the happiness you will get and the results you will get at the end of preparation. So here we try to provide you the what is called as the rate of momentum for your entrance preparation. So one more thing I want to tell is the best time to prepare is internship. Most of the time, I noticed many of these students are enjoying like internship and postponing the entrance preparation. I strongly suggest that the internship is the best period and always the first attempt is the best attempt. So you can enjoy your time, but not at the cost of your life. So make a decision to see that you should prepare right. Okay, enjoy 1 or 2 months. Okay. And next Neet you are going to have most probably all this time around March 2024 you will be having 8 months of sincere preparation. 8 months of sincere preparation is required. And it doesn't mean that you should not prepare right from the day you enter the internship. And this is what we used to have old story. The slow and steady wins the race. But remember that that won't fit for entrance preparation. The only thing is that take a time, have a leap forward that you should not stop until you will get an MDS seat. That's why I always say fast and steady wins the race. And the first attempt is the best attempt. If you see the results of PG entrances for the last 10 years, out of which the 70 to 80% students are from first attempt only. So time and tide won't wait for anybody. And this is what focus on effective and efficient preparation. This is where you need guidance. And here with MDS Conquer, we provide this efficient and effective methods as the technology is improving, as our Dr. SAHITHI madam has explained. We try to utilize this media, different sorts of media, and make you go through what all postings and what are all the videos we have along with you prepared for your benefit to go at any time. That means you can access this wherever and whenever you are free. So try to dream to get a seat. So getting an MDS seat is easy. I don't mean you to get just only MDS seat. And we want you to get an MDS seat where you spend only 1 paisa or 2 paisa to complete your MDS. That means I want to tell that all of you should do a free MDS seat. So PGS is a 70% obvious to all of our PGs. There are 12,000 PG seats, but remember that only below 1,000 seats are free of cost. Free of cost. Now, this is the payment and non-payment seats. I think SRIKANTH has explained all this. We have what is called as now All India PG and PGI, and AIMS and PGI, they have come under what is called as the Institutes of National Importance Examination. I think from next batch, from 2024, they are trying to implement Neet for these exams also. So the Neet is going to only the gateway for your getting to the MDS examination. This is what I used to tell. So decide yourself what you want to do. 2 things. One is free seat, that's a government seat. Another is subject of your choice. The more the hard work you put along the ladder, the better the seat you will get along with stipend. Otherwise, you are made to pay this much of amount, around up to 25 lakhs, depending upon the college. Remember that always the money spent is exponential. By the end of 3 years, if you spend 10 lakhs per year this PG course, and by the time you start earning, you will be almost all indirectly to say that you will be spending around 50 lakhs to 1 crore, which takes 4 or 5 years if you are having a rural practice. So that's why I try to get a free seat, a good seat. Of course, we are here to guide you. And after you finish a free seat, then you can invest and you can start a good clinical practice with the money you had and in your internship, of course, internship for your PG curriculum. And it is highest degree in your field, the natural option. You have to rise in your field, and specialization is important. And wherever you go outside, and that is they ask for either you go to Gulf or any other corporate hospitals within India, the first thing is what specialization you are having as an MDS. And second thing is, from as soon as you enter into the internship, and if you want to settle in dentistry, whether it may be MDS or something else, you have to do MCQs. It is a must. It is a part of your life, whether it may be Gulf or it may be American national boards or UK or anything is from tomorrow onwards. If you want to stay for higher studies in dentistry, it should be MCQs. It should be your life. It should be your breath. It should be your what you drink, what you have, your food as MCQs only. If you want to stay in dental curriculum, that's why what's wrong in preparing for MCQs that are based to give a chance for PG preparation. So you can see how the entrance preparation differs from what you have learned in BDS curriculum. So our BDS curriculum is entirely different from the entrance system of questions what they frame. Our entrance system of questions are most of the times they are based on the American textbooks and sometimes on the Britain textbooks. So if you go through these MCQs, it may become easy for you. And another thing is, while you are preparing for PG, you can prepare for your national boards also. It takes some time for preparing for national boards and get into the states. Meanwhile, you can give a chance. And I have seen some students preparing for entrance and they have finished their MDS also before going to the states. And one more thing is, be positive in approach, and you will be backed up by your, they will be discouraging your seniors or immediately passed seniors. One thing, remember that always the survival of the fittest. You should have better skills. Always try to be in the top slots. When you try to aim at the sky, remember that you reach the top of the tree. That's what I wish. And we provide you to reach your top slots at MDS Conqueror from this year. Hope, wish you all the best and good future ahead. Thank you, SRIKANTH. Thank you.
Thank you so much, sir, for the positive words and vibes. Guys, if you have any questions, one thing is you can drop on the chat box. So here we are there to help you out in clearing your doubts, or if already the numbers were already shared, so that you can contact us directly through the phone, on the WhatsApp or on the phone, that we are ready to help you out in clearing your path. Okay. So is there anything that we need to answer? There were a few questions. You're open to throw your questions on the chat box, or if you want, you can come live also. You can directly talk with the mentors over here.
Somebody has quoted about the forensic background. Yeah, it's nowadays the forensic sciences has started in India also. Gujarat University is offering in Ahmedabad for forensic medicine sciences, and along with MBBS people, BDS people are eligible. You please follow the notifications. Usually it will be in August and September. MSc Forensic Sciences, and mind you, that will also be an entrance-based system.
We are planning to start the next batch probably after Pongal. So we are deciding on January 16th, we are going to start the fresh batch for 2024.
Every week, once we need a motivation class, it's really difficult to stick to the schedule being an intern. And that's where these type of what it's called as MDS entrance preparation classes like MDS Conquer comes into the play. We try to motivate and keep your spirits high. We will be sending you, we will make the reading process or the preparation process easy for you. And definitely we'll try here to boost your motivation, madam. Don't worry about it. And for Australia also, this MCQ based question. First, the Australia will be two parts. One is MCQs and second is the what is called as you have to do just like your practical examination. You have to give part 2. And before COVID, Australian exam we can give in Chennai. I don't know about the present situation. How is it?
Now also we can give, sir.
Yeah, part 1 you can give. Singapore, you can go there and directly give. Singapore, no entrance is there. Only thing is you have to give a qualifying examination or a registration examination. There is no entrance system for Singapore like that. Only you have to be qualified.
Australia part 1 you can give in India, even in Hyderabad also the centers are there. But part 2 you have to move to Australia. But thing is, I feel like it is expensive. It's a bit expensive. If you fail, you have to pay again 5 lakhs. I think the fees is for part 2 practical exam is more, I think like Indian around 4 to 5 lakhs. So if you fail again, you have to give. And second thing about Australia is they strictly follow the dentist to population ratio. They open the openings only when the population ratio is not up to the nominal ratio that is given by WHO. So whenever it is beyond that, they don't take the foreign dentists. Okay, that is the main thing problem with the first Australia.
Fellowships are also same thing like this. Your PG only. It is nothing but your PG. That fellowships also you can complete in-house. That means in India itself. But again, for practicals, at least 3 to 4 months you have to be in UK to get that fellowships. UA examinations, yes, it is a UA exam. So many exams are there, depending upon the country where you are going. And expenses, what expenses? Exam expenses is around 20,000 to 30,000 maximum by checking your credentials also. And other expenses will be there for your visa and all that. And for UAE, for BDS, I think they are paying around 1.5 to 2 lakhs per month now.
But UAE requires experience. Experience is mandatory.
Experience, even without experience, now they are taking SRIKANTH. But only thing is they are paying less. And army examination, army now, it doesn't have, it's not having any separate exam now. It is with the Neet exam now. You have to sit for a Neet examination, and Neet results are taken as the qualification mark for army entrance. So this army entrance has, once you get into the army, there are 2 types. One is short service commission and another is long service commission or permanent commission. Short service commission is 5 years. Within these 5 years, after 3 years, you can take a chance. They will have the entrance system like again. You have to take a chance and you prove yourself that you are fit, worth to a permanent commission officer. Then if once you qualify their exam after 3 years, you will be permitted to do PG anywhere in India on pay leave. That means you will be paid full month salaries for 3 years. You can do that. Once you complete that, you will become a permanent officer in army. For 2024 July session, we cannot tell it now. Actually, it will be 3 months before the notification of the examination. We have to wait and see how the notification goes. Because previously it is that by the May 1st or May 31st, by the end of May 31st, all the PG courses should start in India. There is disruption for the last 2-3 years. They are trying to channelize and make it again a regular stream. We have to wait and see. Not only USA people consider MDS degree, they even don't consider the BDS degree from UK or European countries. It is a system what we follow in each country to protect their citizens. They should prove that they are worth it and they are more skilled to treat their own citizens. It is not like USA or any discrimination. It is all countries. Only in the Indian degree, BDS degree is directly recognized by UAE, Maldives, and some West Indies, of course, some African countries. But UAE, again, still you have to do a qualification examination. Remember that only where you need not do any qualification exam is even in Sri Lanka, you have to give qualification examination. I think only in UAE. In UAE also, they will conduct what is called as ProMet or some qualifying examination. Without any qualifying examination, a second country's BDS degree is not recognized by any one of the countries in the world. process to get through deemed universities. India means some deemed universities like Savita, Manipal, they have joined in the Neet scheme. Some they have not joined. You have to see the notification. They will issue guidelines and all the universities which are there in the Neet umbrella.
Yeah. More than 15 deemed colleges are there with the Neet. You can go with the Neet counseling itself. A few colleges, the counselings will be done through the state, and few directly the colleges will fill the seats. But Neet rank is mandatory for any admission. You have to qualify Neet, you have to get a rank in Neet.
Not qualification, rank. Now rank has become very important. Singapore MDS, you have to prove your credentials, not only your education system, how much your aptitude to do an MDS, that you have to have some credentials like your publications or any other skills. And again, you have to clear your basic BDS recognition examination, then only you can join in MDS. Yes, all European countries, apart from a qualifying examination, they have some English examination. For all the Asian countries, you have to qualify the English examination as the first examination point before entering into the European countries. Apart from that, each country has a qualifying examination. It is a rule. And MDS in India or abroad, why do you want to do abroad? I don't know. Now the MDS, we have best colleges in India itself. I think you can post your doubts at any time. We are ready to clarify all the doubts. Thanking you. Thank you, SRIKANTH. Thank you, SAHITHI madam.
Thank you, sir. Thank you so much.
Thank you, sir. Thank you very much.
Okay, guys, we are done for now. Any more questions before we close the session? You can post the doubts. So I hope this session is like more informative. I mean, like, first of all, we should know what is happening. Then we should know whether we can fit into that or not, whether we can survive in that or not, whether we can reach that financial limitations or not, whether we can, whether your parents are open for that or not. So there are many other things, that few things you have to discuss with your parents and come out, then we can like plan accordingly. Okay. Next one, how much we should score to get into GDCs for a reservation? It's not about score. Score varies. Like, for example, if the question paper is too easy, if you know all 240 questions, you'll only keep few questions and come, or you will attempt all 240. So if the question paper is easy, then the cutoffs will vary, but ranks will never vary. Ranks is always same. Like, for example, an open category to be in All India, like to crack government dental college through All India counseling, you should have a rank of at least 350 below. Okay. And if you're having any background of OBC reservation, OBC is almost like an OC. It is somewhere around 350 to 400 All India. You should be 350 to 400 All India to get an OBC seat. Okay. And EWS has an extra edge compared to OBC. But EWS, we cannot predict how many EWS people will be there in the top list. Like, as of now, 500, 550, 600 also EWS seats are coming. This is only to the national level, but not in the state level. Okay. And next goes SC category. Like, even 2000, 1500, you can keep 1500 or 1200 as a target. If you are 1200 or 1500 below All India, you are getting a good clinical seat. For an ST, it will be 2000. 2000 All India below, you will get a good clinical seat. And coming to PH, physically handicapped, the number of students attending physically handicapped will vary, like very less in dentistry, but you need to have a proper certificate that is being approved by the central government for that. And sometimes they're going to keep one seat, at least like one seat sometimes. If the seat is not filled through physically handicapped, that seat will be shifted to open category in the second round of counseling. So this is for All India counseling. State counselings, it's going to vary because every state has a different pattern of reservations. For example, you take Telangana and Andhra, we have something called as, we don't have an OBC, we have a BCA, BC, C, D, E, something like that. And similarly, Maharashtra has a different pattern of reservations for them. And similarly, Karnataka has a different pattern of reservation. So they have their subcategories of reservation. So basing upon that, it vary from state, it vary to all India. That's all. That is all about reservations. Anything more, guys? Yeah, let's start the preparation. Okay, it will be difficult for the first few weeks, but if you work hard, because the first few weeks are going to determine your character, like people who stands or withstands in the first 1-2 months. So no one can stop you. But most of the people, they fail to reach that first 2 months. They start reading for 5 days or 10 days or 15 days. They come to a conclusion that we cannot read, we cannot do this. It is very difficult to understand. This year, it is not possible. So they come out with an options like plan B and plan C, joining a clinic or enjoying the internship or doing something in internship. And finally, everyone, you, me, and everyone will definitely give the examination and they feel bad after the result. So this is what regularly I monitor and I see from my students from the past 7 to 8 years. So I strongly recommend to break that first 1 to 2 months. Talk with the mentors, take their suggestions. First 2 months, if you cross, no one can stop you, no one can break you by reaching your goals and by reaching your good rank. Okay. Anything more before we close the session? Okay, guys. Okay, rest everything. I hope you have our number. Okay, so Sahithi ma'am and I are always available on the groups. Okay, so whenever you want, you have anything to discuss. Okay, so Gauri Shankar sir will be there, a legendary person with lots of knowledge and wisdom to guide us in a better pattern. Okay, so that is the reason why I always take suggestions. I always love to talk with my HODs, particularly with my HODs. Whenever I go to college and interaction, I used to sit with the principals, HODs there. I used to just hear their words because they have lots of wisdom with their experience. Wisdom is most important thing in the dentistry. You can just learn just by hearing them, their experiences, what they came across in their life and everything. Though that's what I get motivated from them. I love to talk with my HOD always. Okay, so bye, take care. Anything, Sahithi ma'am?
Yeah, so I'll be glad that if you join and if you start the preparation during internship itself. Okay, so yeah, initial days, it could be a little tough, but don't worry, you're not pulling the rope alone. We are behind you, who's helping you out in every day, every moment. So if you try to pull it alone, you'll definitely feel it to be tough. But if you take help from us, guidance from us, the things will be easy and comfortable. So do get into this irrespective of what you're going to do after your internship. Either you want to go to the abroad or you want to stay in India, anything, the main platform on the basics is doing the MCQs. Okay, so you can't sit today and think after 2 years what you're going to do. So during internship, rather than wasting your precious time, because already you are into clinicals, so you will have that exposure. At the same time, if you start doing this MCQs pattern, you will be having an ease and an edge over others. So definitely try to be. And even the repeaters, if you are interested, definitely you will have an edge when compared to any other students across the country. Okay, so try to be positive always and try to be in touch. So if you're in touch with each mentor in our team, you will be definitely be at the top. So don't hesitate at any point of time. We are here with you. So we'll be handling your hand. If you trust us, we'll catch your hand and will not leave your hand until we throw you in your respective dream department in a dream college. You might leave a hand, but we will not leave you. Okay, so trust us and be with us. We'll be glad to be in touch with you. Yeah, that's it. So have a nice day.
Yeah, that's all, guys. Okay, advance happy Pongal, Sankranti, and all these things. And we're going to restart the things, as I said, like on January 16th. And of course, you can proceed with the rest other things. And people who are going to hear this video on YouTube or any other media as a recorded version, you're always open to ping us and to know us the latest batches which are going to start and what are the possibilities and everything. We are always open. Okay, we always try to help people. Okay.